rectus diastasis? That is the question. So we typically see rectus diastasis in the postpartum patient, but really you can see rectus diastasis in any condition where the belly gets stretched out. So that might be somebody who was overweight for a period of time and then maybe lost that weight. But essentially, all rectus diastasis is the six-pack muscles, which normally help to maintain the integrity of the abdominal wall. And during pregnancy, or let's say during a fair amount of weight gain, those six-pack muscles actually start to get pushed to the side. They get pushed apart. And that effectively is going to create some weakness in the abdominal wall because there's really no strength layer to the front of the abdominal wall. So the real question is, well, why does this really matter? Well, if you're a woman, this probably matters because after you're done having children, you probably don't want to look like you're still pregnant. And unfortunately, that is what essentially can happen with a severe case of rectus diastasis. So the abdominal wall essentially can no longer hold in the internal organs, and everything then starts to protrude and essentially gives you the look that you're 6 months pregnant, which is really not acceptable for most women who are in their late 30s and 40s and have children that are grown up or already off to college. So what about sit-ups? That's the big question. Everybody wants to know, will sit-ups or core strengthening, will that help with diastasis? And unfortunately, the answer is really no. Rectus diastasis is an anatomical problem, which means that once those structures, those six-pack muscles have been pushed apart, they're not going back together. No matter how many sit-ups, crunches you do, all that's going to do is going to tone and strengthen the muscles, but it's not going to put them back where they need to be. In effect, diastasis is almost like having a hernia, but not quite as severe. So what people want to know is, well, what can you do about it? So there's really two things that I recommend. The first one is take a look at your weight. You want to be as close to your ideal body weight as possible. You may need to go online and Google ideal body weight, and based on a couple different factors such as your gender and your height and everything, you can determine roughly where you should be in terms of a body weight range that's safe for you. If you want to have the best cosmetic outcome possible and the least amount of complications and have a safe operation, you want to be as close to that as possible, okay? You may not hit it on the nose, but if you're 40 pounds above your ideal body weight and you can get to 15 pounds above your ideal body weight, you've just done yourself a huge service. The second thing is you need to find a plastic surgeon, and not just because you necessarily need to have an operation right from the get-go, but you at least need to have someone evaluate you who deals with this on a regular basis. And it may be that you have a hernia, and maybe you need an actual hernia repair, which is a lot more involved. So first, go see a plastic surgeon, get a consult, see if you in fact have rectus diastasis, how severe it is, and what the next steps will be for you. So the last thing is, well, you've got rectus diastasis. How are we going to fix it? So unfortunately today, there's really no options in terms of non-surgical alternatives to repair rectus diastasis. Diastasis is an anatomical structural problem, and the only way to fix that is to put that structure back to where it used to be. And the only way to do that we know of is surgically. So that procedure is essentially a tummy tuck. And one of the components of a tummy tuck is the plication of the rectus muscles, which repairs the rectus diastasis. And to make it pretty straightforward, we're essentially just sewing the six-pack muscles back together. And that is going to give you that nice flat belly. It's essentially how we correct these problems. So hopefully you have found this informational, and we hope to continue to bring more informational content to you so you can be educated in all things plastic surgery. If you have any comments, suggestions, things you'd like to hear, questions you might want answered, please leave them in the comments section below. And as we continue to grow this channel, we hopefully can get all those things answered for you. In the meantime, if you want to check us out at arslanianplasticsurgery.com, that is ARSLANIAN. You can also find us on Facebook at Arslanian Plastic Surgery and follow us on Instagram at Dr. Brian Arslanian. Hoping you have a great day. Thanks.